The White House COVID-19 response team and federal public health officials lauded a vaccine booster during a virtual briefing on Tuesday to provide updates on the COVID-19 response efforts. Top health expert Dr. Anthony Fauci encouraged people to get this new vaccine booster as soon as they can for optimal protection against the Omicron variant. Participants in the virtual briefing include Fauci, Health and Human Services Secretary, White House COVID-19 Response Coordinator, and Center for Disease Control and Prevention Director. Federal health officials on Tuesday approved a new booster designed to battle the dominant Omicron variant. People can get booster shot this week at pharmacies or other designated locations.
That vaccines containing sequences from both the original SARS-CoV-1 virus and the Omicron BA.1 variant induced higher antibody titers against Omicron than did the original vaccines. These bivalent vaccines also induced higher antibody titers against all SARS-CoV-2 variants than did the original vaccines. In addition, the bivalent vaccines induced even higher levels of neutralizing antibodies in individuals who had recovered from COVID-19. And so we fully expect that the updated bivalent vaccines containing BA.4, BA.5 sequences will offer better protection against currently circulating strains than the original vaccines, although it is difficult to predict at this point how much better that protection will be. In conclusion, we know that the mRNA COVID-19 vaccines are safe. We know that receiving the recommended vaccine dose is critical to maintaining optimal protection against severe COVID-19, particularly for the elderly. And we expect that the updated vaccines will offer better protection against the SARS-CoV-2 subvariants that are currently circulating. And so, my message to you is simple. Get your updated COVID-19 shot as soon as you are eligible in order to protect yourself, your family, and your community against COVID-19 this fall and winter. I certainly will do so. Alex, I think what people need to appreciate, although it's very important that we are now matching the new updated vaccine with the circulating, that the original ancestral strain vaccine created a very broad degree of coverage that did very well against many of the variants, as you know, from the D614G to the Alpha, Beta, Gamma, Delta, and even Omicron. So we don't want to deprive the population of getting that broad coverage at the same time as we give them the added benefit of a variant specific that's circulating. So I think it's a very positive thing that when you get people to get their primary vaccination, you give them the benefit of that initial broad coverage. So there's a good reason to do that.
Sublineage accounting for over 88% of circulating viruses, and BA.4 sublineages accounting for over 11% of the remaining circulating viruses. The 7-day average of hospital admissions is about 4,500 per day, a decrease of about 14% over the prior week. Since April, we have seen a greater increase in hospitalization rates in older adults relative to other age groups. For the week of September 3rd, over 63% of hospitalizations are in those 60 and older, and about 46% of hospitalizations are in those 70 and older. The 7-day average daily deaths are still too high, about 375 per day, well above the around 200 deaths a day we saw earlier this spring, and in my mind, far too high for a vaccine-preventable disease. Data have repeatedly demonstrated that being up to date on your COVID-19 vaccination provides protection against severe illness and death from COVID-19, especially for those most at risk, including those over the age of 50 and others at high risk of severe disease. Additionally, a recent JAMA article also demonstrated that healthcare workers who received 1, 2, or 3 doses of vaccine were less likely to have long COVID compared to those who were not vaccinated. Last week, following FDA's emergency use authorization, CDC's Advisory Committee on Immunization Practices recommended Pfizer-BioNTech updated COVID-19 vaccine for people ages 12 and older, and Moderna updated COVID-19 vaccine for people ages 18 and older. CDC and ACIP recommend that everyone, regardless of the number or type of previous COVID-19 doses, receives a COVID-19 bivalent vaccine this fall. You can receive an updated vaccine dose at least 2 months after your last COVID-19 vaccine dose. As 99% of circulating viruses in the United States are BA5 or BA4, updating our COVID-19 vaccines to match the circulating variants helps us to better be protected against these variants and future variants that might be closely related to Omicron. Getting an updated vaccine this fall will help restore protection that has waned since previous vaccination, and laboratory data suggests that the addition of the Omicron BA4 and BA5 spike protein components may help broaden the spectrum of variants the immune system is ready to respond to. Finally, modeling projections show that an uptake of updated COVID-19 vaccine doses similar to an annual flu vaccine coverage early this fall could prevent as many as 100,000 hospitalizations, 9,000 deaths, and save billions of dollars in direct medical costs.